We will start our meeting. Just want to wish everyone a happy Ramadan as well. Ramadan Mubarak to those celebrating. And before we get started, if there are any questions, please don't hesitate to unmute yourself or ask directly in the chat box to myself or Gina or Seely, other public health colleagues. This meeting, we're going to kind of go over a lot of things centered around COVID, what's coming up May 11th, with the declaration ending, around testing sites, COVID variants, and then a couple other events that are happening within the county in the next couple weeks. So with that, let me just exit a couple screens here. So I kind of wanted to start off and talk about a couple of the COVID testing site closures. So as of last Friday, March 31st, as you'll notice on the screen, we have the Auburn, Harborview, Rainier Beach, Shoreline, and West Seattle. All those COVID testing sites have now since closed here in King County. Right now, we are, recommending folks go to their local pharmacies to get tested for COVID, or perhaps ordering from government websites to get your free COVID tests. And this is all in preparation to the declaration that is happening on May 11th, when COVID testing funding is kind of going out the door. So we still have a couple spots left for COVID testing. One is going to be in Bellevue College, and the other one is going to be in the University District. So those are the last two sites that are still up and standing here in King County for COVID testing sites. So some local and health clinics and pharmacies will continue to provide free or low testing by appointment. We will send the links out in a bulletin following this call. But you can find all that information around testing on our kingcounty.gov/COVID testing to get some of the most up-to-date information on site closures and which sites are available, and how to book an appointment at your local pharmacy if you don't want to do an at-home COVID test. And we're continuing to work with, our public health clinics here in King County, libraries and community centers. And libraries and community centers still distribute free COVID-19 home tests to the public. And then also we have a link that gets shown in a couple of our bulletins where you can order free home tests for your organization to distribute as well. So I'm actually just going to do one thing here. I'm going to click on this link and I'm going to drop it in the chat box. Maybe I'll do that a little bit more towards the end of the meeting. But if you do work for a nonprofit and you want to order COVID test kits, it's probably right now is going to be a good time to get those in before the May 11th order comes in. So, or if maybe Seely, you have that order form for the over-the-counter test kits, if you could drop that in the chat box, that would be greatly appreciated. All right. So in the meantime, so leading up until May 11th, where to get COVID-19 tests. So we talked about those two sites that are still open. So one's going to be in Bellevue and the other one is going to be in University Place. So those are two physical sites that you can drop into to get a free, no-cost COVID-19 test. I would say all local pharmacies offering COVID-19 tests are also a good place to start as well. We will be transitioning come May 11th, but we're kind of going to be talking about that a little later on. But in the meantime, aside from those two spots that we have in Bellevue and University Place, our local pharmacies, and also a couple online places from the government, which you can get your free COVID test. So the Washington Department of Health Say Yes COVID test program, it aims to prioritize high needs communities, and that's going to be ending on May 11th. So the links that we will be sharing afterwards where you can order those free COVID tests, they're up and running right now. We have just around a month left to utilize that program to get free tests delivered to you, 2 at a time. And then the State Department, so the DOH of Health, will continue to operate their Say Yes COVID-19 test program up until May. So they actually mail 5 free COVID tests, and they've adjusted the program a little bit here to kind of focus on some of the hardest hit communities within the county. So some of the highest zip codes that experience kind of COVID in King County are going to be prioritized on a first come first basis when it comes to those 5 tests. But if you live in a zip code that you're not sure if they are focusing on, might as well just get those requests in, because come May 11th, COVID tests are no longer going to be free. But again, we'll kind of touch upon that in a second here. I just kind of wanted to highlight a couple of the locations that won't be up and running. And thank you, Celie, for dropping those links in the chat box. So the first one is going to be a form where you as a nonprofit can order at-home COVID-19 tests that you can distribute to community. And this is really important given the funding around COVID testing after May 11th. Let's go to the next slide. So potential costs for COVID-19 vaccine and antiviral treatments. All right, so after May 11th, we've kind of all been hearing little whisperings on what's to come and what does that actually mean. So first and foremost, COVID-19 vaccines and antiviral treatments, they are free and they're free to the public, and they will remain free even for people who don't have insurance, as the federal government currently has a large supply of vaccine and medication that is said to last and predicted to last until the end of summer. And this goes for vaccines and COVID-19 treatments, and they will remain available depending on the product through the end of the year. So we believe that we have enough supply to keep COVID-19, vaccines and treatments to last us until the end of summer. And then what's to come once that Federal Reserve dries up is a little unknown, but we have kind of a speculation, which I'll talk about in the next slide. But after these, free federal supplies run out, the COVID-19 vaccines, and treatments, they're going to shift to the private market. So that's kind of what we see with our flu vaccines or our flu shots and various other vaccines that we've had throughout our lifetimes. They've shifted to that private market. Let's go to the next one. So what are the potential costs for COVID-19 vaccine and the antiviral treatments? So getting, the COVID-19 vaccine, and this is, again, after the federal supply has ended, come near towards the end of the summer. We think it's going to be similar to getting the annual flu shot or other annual routine vaccines. So COVID-19 shots and boosters will always continue to be free for children. This is 18 years or younger. And this is, come December of next year, come January of 2024. Anyone age 18 or younger is always going to be able to have the COVID-19 shot, booster, primary series, free of charge if you're under the age of 18. In addition, most commercial insurances, so whether you have like Kaiser or Medicaid, Medicare programs such as those, they will most likely cover vaccines for their members at a whether it be free or a low copay. And for folks who are, underinsured or low insured, we're probably going to see a similar price tag around what it is for the annual flu shot. So obviously that price range ranges, but we're thinking maybe around $50, but it's still a little too early to kind of predict. The same goes for COVID-19 treatments. So starting later this year, again, when the big term, the Federal Reserve kind of dries up here in the summer, we're going to likely have a out-of-pocket cost for COVID-19 treatments. And this, again, is very dependent on the insurance that they have. So this would be similar cost to people have for other drugs, other traditional coverage. So whether you're paying co-pays for a certain prescription that you get, those are likely going to run around the same cost for the COVID-19 treatments here within the county. So we are working, the federal government is working with vaccine and treatment manufacturers to ensure that the patient assistance program provides free access to these products, and they're easy to use, and they are broadly accessible. And again, I just want to make this clear that this is all coming starting May 11th. The pandemic quote unquote, is ending federally in terms of a lot of funding issues, so around COVID tests and around COVID vaccines and treatments. But when we talk about the COVID vaccine and we talk about the treatments, nothing should change until we get to the summer, the end of summer, the fall time, when that Federal Reserve has kind of dried up. And thank you, Celie, for continuing to put those links in the chat. And if anyone has any questions, please feel free to write them in the chat or unmute, come on board. We're kind of shifting gears a little bit here, but I just want to highlight that some people may need to re-enroll for Apple Health or Medicaid coverage. So the COVID-19, federal emergency declaration, it temporarily prevented anyone from losing their Apple health care. So even if their income increased and they were no longer eligible, and with the order ending this spring, so on May 11th, some people are going to be required to complete a renewal application to keep their Apple Health coverage. In the next coming months, Apple Health, may send a letter to you from the state about renewal instructions, and they're giving you a 2-month window to respond. So we're asking folks, if you've updated your address, you're not sure what address you have in file for Apple Health users, to make sure that you kind of update the correct mailing address, especially if you don't have mail forwarding, and that your email is up to date. So you can go to the WashingtonHealthPlanFinder.org and kind of get linked up to your online account there. They're also going to be having a lot of support around this as well. So public health will be working with community partners in the coming weeks to conduct outreach and assist anyone who may be at risk at losing their Apple Health coverage. And public health insurance navigators are available to help you with any information that you have around Apple Healthcare or affordable healthcare options. And we give you a number and a link in the chat box as well. Any questions on that? No, awesome. Let's go here. Perfect. So talking about treatment, so there's a couple treatments here. So we have the COVID-19 antiviral medication, such as Paxlovid, and that's purchased by the federal government. And this will remain free regardless of insurance coverages until supplies run out. So kind of the same theme that we have with COVID-19 vaccines. Paxlovid will remain free regardless of insurance, your insurance level, until the supplies run out. Again, not sure when, but it's predicted to last us until summer, maybe early fall for that antiviral medication. So when the federal supply of antiviral medication runs out later this year, we're going to experience, an out-of-pocket cost for the COVID-19 treatment. Again, this is depending on the type of insurance that you have, but it's going to be around the traditional co-pays that you see with other drugs, traditional coverage drugs that you get with your insurance. So just a couple days ago, the masking requirements in healthcare, long-term care, and correctional facilities, they ended. So on April 3rd, so we are 2 days in to the end. The Secretary of Health mask order, which currently required universal masking in healthcare, long-term and adult correctional facilities for people age 5 and older. I was in a hospital the other day in a Kaiser, and they still had their mask order in effect in the one that I was in. So this is going to be really dependent on the setting and the area that you are in. Hospitals, long-term care facilities, and correctional facilities are going to have the final say of how they want to operate their certain location. They still may require masks or ask that patrons use masks to enter their establishment, but they do not have to, given that the Secretary of Health mask order currently ended on April the 3rd. And then I see Celie, my friend, you have your hand up.
Yeah, there's just a message in the chat box I wanted you to be aware of from Aaron. You want me to read it or?
Nope, I can read it, my
Okay.
friend, but I will read it out loud. So are there no exceptions being made for people of higher risk, immunocompromised and elderly? Let's see, 349. So I think that is in reference to the mask order, if I'm not mistaken. Um, so like we stated before, some hospitals are making decisions to continue to use masks. At the Kaiser that I was in, Gina put in the chat box, the University of Washington, Swedish Medical Center, Overlake. Um, it is not specifically aimed at um, exceptions for people with high risk or immunocompromised or elderly. They are requesting folks in these hospital settings to still wear a mask. But if that establishment, takes away that order and it is only a strong recommendation, that's kind of where it ends. So I've heard in chatter that a lot of long-term care facilities are keeping up with their mask wearing when it comes to long-term care facilities. But I've heard some hospitals have been dropping it as well, and doctors' offices have been dropping the need and requirement for a mask as of April 3rd. Providing testing and treatments to those people as well. So when it comes down to, a lot of individuals who are in long-term care facilities, if they are on Medicaid or Medicare, they're still going to get the testing and the treatments and the COVID-19 medication free of charge. So it works a little bit differently for those individuals. Testing in hospital and long-term care settings will always be provided. It may come from people's insurances, but we're not going to see a decrease in testing for individuals that are in long-term care or hospital settings. What we're going to see is a decrease in testing for the general population, and the ability to just pop in and get tested at your local pharmacy free of charge. So routine testing, I think, at this point is not a thing of the past, but it's not as like utilized as it once was. So testing has really shifted to if there are symptoms. But the treatment and the testing for immunocompromised people should stay at a high level. It's all going to depend on insurance, but if you are in that hospital or long-term care facility setting, you're not going to see a decrease in testing or treatments if you were one of those individuals. Not sure if that answered your question, but please feel free to unmute and we can chat away if needed. All right. Yeah, so it is interesting. I'm my hospital experience the other day when I went in for something really quick. I was wondering if it was still going to be masked, and it was. So I was kind of glad to see that. All right, I gotta minimize some chat box here. So this kind of just goes on talking about the previous Secretary of Health mask order that lifted on April the 3rd. So there's a lot of words on this slide, but I'm going to kind of paraphrase. So folks, individuals who work in these settings, you have the right to stay masked if your establishment and employer is saying you don't have to, and you will not be penalized, and you have the worker protection requirements, L&I, that will remain in effect to help protect you and employees and contractors if you choose to wear face mask or other personal protective gear. So I just kind of wanted to highlight that with the link if you found that necessary as well. All right. So before we kind of get into the general COVID in our area here in our county, does anyone have any questions on what's to come after May 11th? And then I see Dr. Seema, Virginia Mason at this point has also decided to keep the mask requirements. All right. Yeah. So that's two we know of. Gina put a couple in there. I can say the Kaiser and Capitol Hill as well has chosen to stay masked.
Yeah, I have a direct question, Justin. So what you're saying is after May 11th, if somebody wanted a COVID test, they have to pay for it out of pocket or through insurance? Is that
Yep,
what's happening?
that is correct. So right now, COVID-19 tests are free of charge for everyone. We have 2 locations that are floating around here in the county. And then you can still order, your COVID-19 test from the government, whether the local government or the federal government. But after May 11th, the COVID-19 tests are no longer going to be free of charge. So most folks who have insurance and are insured will be able to pop into their local pharmacies or their local hospitals or wherever they go get care with their insurance and have that COVID test be covered. But really, the point for a lot of community members who are experiencing, no insurance or kind of are underinsured is where we're going to see the biggest burden around COVID tests. So there are going to be a lot of nonprofits that have, stockpiles of at-home COVID tests that they'll be able to access, and we'll kind of, see those advertised at a lot of health fairs throughout the season. Our public health centers in King County, I'm not sure if anyone on this call has a direct answer, but I would imagine those 4 health centers are also going to be a place for folks to get free COVID-19 tests. But for individuals who are uninsured or low insured, just to pop into your local pharmacy or the pop-up clinics that we have around COVID-19 test sites here in the county are going to be a thing of the past, and they're not going to be as accessible or they're not going to be accessible at all. So May 11th is the day where COVID-19 tests will no longer be free for the general public. And that's where folks' insurance will kick in
And
and take care of the cost.
and then a follow-up to that is, I mean, this person works with a lot of undocumented folks. So, because I think people who got vaccines, they weren't asking for citizenship, but
Mhm.
how will that work if they don't have, that proper insurance or Apple Care or these vaccination sites? What would public health recommend for the undocumented resident?
Yeah. So, I mean, first and foremost, I would order as many COVID-19 tests that you can get from that link that Celie put in the chat box. We can start there to help, distribute to community. I don't have a direct answer for the questions that you have around undocumented and what are the next steps when it comes to getting COVID-19 testing. I know a lot of nonprofits in King County are going to be great places to offer resources for access to COVID-19 tests, for access to COVID-19 vaccines. But I would like to get you a better answer. So maybe if you could just, if you would write Celie your email address and we can kind of follow up with you to kind of point you in the right direction for some better answers.
I'll send that over.
Okay. Awesome, my friend. Nice.
And I did see Lika's comment. I will post the link again.
Yeah. And then Becky, I don't know, are you on this call? Let me see.
She isn't.
Nope. Okay, perfect. All right. So let's talk about a little bit about COVID in King County. Let me just see here. So COVID-19 is decreasing in the US, and it is definitely decreasing here in King County. This is something that we've been talking about and have known for months now. So the trend in King County, we are low. So the current COVID-19 community level in King County is low, and we have been low for roughly around 5 months now. Even given new variants that we've seen in other parts of the country, we've remained at a low community level. And that's great. And there's a lot of factors that kind of play into that. And a lot of it starts with the fantastic work that you people do within community. So much love and appreciation for that. But I just want to highlight one thing as well. So when folks are sick, the idea is to get tested. And from there, we send our test results to public health. But something that has skewed the data and we've known about for a while is that most times lately, as we pivoted to at-home COVID tests, we're seeing that people are sick. They are not testing, which means information and data and case counts are not getting reported back to public health. This has been a problem for quite some time. So a lot of the data that we are getting is either coming from our testing sites, that we have since shut down a majority of them, or disproportionately aimed at the elder generation who have hospital visits because of COVID-19. Um, so what we're seeing is public health recedes data from people who seek out testing. The case count, because of this, becomes a little bit less reliable. And then we turn to hospitalizations and death data for disease burden. All right. And kind of on that theme as well. So with our COVID-19 hospitalizations, they occur disproportionately in our older age groups. When you look at the statistics here, and that is for a couple reasons. One, our older population is often, more immunocompromised than the younger generations. And we have a lot more statistics on our older generations having COVID-19 cases due to the fact that they're in the hospital, and folks, in younger age brackets are getting sick, either not testing or getting sick and not reporting it to the government as well. So just kind of want to highlight that that is something that we are aware of. We know it's an ongoing problem, and they're continuously trying to mitigate how to find data and stats on that moving forward. So COVID-19 vaccines, as we've been saying, remain a key part of public health intervention, keeps the hospitalizations down, it keeps the deaths down, and it also helps us attack and keep long COVID down in folks who have, had COVID previous. We've had great success here in the county with our primary vaccines. So if you look at the far left there, which is kind of highlighted, we had 85% of our population get the primary series. So that's going to be, dose 1 and dose 2 of Moderna and Pfizer, or dose 1 of Johnson and Johnson, which kind of came into effect January 2021. So 85% of us have that. Where we need a little bit of work, though, we'll just look to the right there on the screen, is getting people up to date. So up to date, receiving, the updated bivalent booster. We only have 31.6% of the population who have received the updated bivalent booster, and 32% of our population is up to date with all vaccines. So many reasons, many factors. A lot of it is going to be the fatigue around COVID. But as we, kind of shift towards the end of the summer, when that Federal Reserve of free COVID-19 vaccines kind of run up, is when we're going to start seeing the cost around boosters and vaccines for folks who are uninsured or less insured. So keeping up with that messaging around boosters, and if anyone needs a thought partner or thought process to kind of combat that fatigue, this would be a good space that we could all brainstorm together. Or please do send me an email, and we can be a thought partner that way. So I got my bivalent booster 2 days ago. I too was a little late in getting it because it's been around for a while, but I kind of wanted to beat the Federal Reserve rush that we're projected to see. So nothing around COVID-19 vaccines and boosters will change until we near towards the end of the summer. Just wanted to kind of say that as a reminder. So vaccine preventable infections around COVID-19, we have annual boosters, which are made available in the fall. They allow for updates based on the circulating variants, and the boosters will provide the extra immunity protection, especially for those at the highest risk for severe disease. So we believe that this fall we will have another booster, because the bivalent booster came out, I believe it came out in August, maybe July of last year. So we're rounding the bend for another booster come early fall, when we look at the next flu season and the next COVID-19 fall season with colder weather happening again. All right. Any questions before we kind of jump on to talk about the bivalent booster shot and what it is? Awesome. All right. So the bivalent booster, it's also known as the Omicron fighting booster. It's a booster for the original virus, and it has the Omicron variant. So this is going to be the same model as we use for every booster moving forward that I was just talking about. It will take the original virus of COVID-19, and as we look at the past year, we will kind of build off that. So next year, we're probably going to get a booster that has the Kraken variant in there, um, so on and so forth. So how is it administered? It is a single shot, and you can get it. You can have it 2 months after your most recent COVID-19 vaccine. The side effects are going to be pretty standard to um, all the other vaccines that you had around COVID. So you're going to have mild to moderate side effects for a few days after your vaccine. For me, I was super tired and I had a sore arm, but it was nothing more than that. So who can have it? So we got Pfizer. Anyone age 5 years of age and older can receive the bivalent booster, and Moderna, 6 years of age and older, can receive the bivalent booster. And it is okay to try a different vaccine. If you got Moderna, let's say for your primary and your booster, and you want to switch it up, you can get the Pfizer, and it works the same with your Pfizer vaccine as well. So yeah, so we are recording this, and the plan was to have it out on, let's see what day it is. The plan was to have it out on April the 18th is when the next bulletin will go out. So in just a week and a half is when we'll be following up with a recording and the link to this PowerPoint as well. But I can send you the PowerPoint sooner if you would like, Mr. David, if that would help. But the recording is going to be embedded in the bulletin that we send out. All right, let's go minimize some things. So talking about boosters and why this is kind of important as well, it's going to maximize our protection. So boosters help, protect you and your body's protection from the first vaccine as it weakens over time. We get boosters with other common vaccines like tetanus as well. This has been pretty standard in the way that we've been brought up. You may get COVID-19. You may get it after you get the booster, but having a booster means, you just won't get as sick. So people with boosters can have fewer symptoms. They can have a milder disease than those without one. And they definitely are going to prevent, the majority of the time, the hospitalizations that come with getting COVID-19. They make people with COVID-19 less contagious. And when you get a booster, you do your part and you help spreading the virus. These are just some of the important talking points around the booster. But really, when we're in community, having an understanding of, when you look at the data, you have 85% of the population who've had the primary shots, 31% who've had the updated bivalent booster. What is the disconnect there? We have folks that already, got the vaccine, and now we're struggling to get folks getting the updated booster. A lot of it can come down to fatigue. This is now on year 3. When we're talking about COVID, folks don't want to talk about it anymore. There's an understanding that once a year now, we're going to have to get this COVID-19 vaccine, COVID-19 booster. It hasn't been normalized just as yet as the flu shot has, but over time, I think, it's going to be a little bit more standard in society that the COVID-19 booster goes hand in hand with the flu shot, and it's just going to be a way of life. But right now, things are a little crazy. We're just like going back in society, and it's taking folks a little bit of time to get to the full swing of things. But I don't know if anyone has any thoughts on that, or maybe can share an example how they're combating fatigue within their community and keeping up with the messaging around boosters. I'd be very interested to hear from one of you folks of how you're kind of doing it.
I think Erin has their hand up.
Oh yeah. Hey, Erin.
Yeah, hi. Actually, I just had a question. So I work as a COVID Care Connect coordinator, and I speak to people who have COVID on a regular basis. And often I actually encounter people who've gotten their first shot of the initial vaccine, but haven't gotten their second one, and they're wondering about getting a booster, or if after so much time they haven't gotten their second initial shot, if they need to start over with the shots. Can you give me a little bit of information about that I can relay to my clients?
Yeah, definitely. So the most important thing is to get them, you know, back in the chair to get a vaccine. They will most likely get given their primary series over again. But that being said, they can go and get their first dose and then get a booster right after. It doesn't necessarily need to be a 1 and a 2. They can get a 1 and then get their updated bivalent booster. Most providers are going to want to vaccinate them again from the start with their primary series because they didn't get, shot number 1 followed by shot number 2. But what we see with the bivalent booster, it actually took the original, added the Omicron. So it's giving us greater strength to it. So we can jump from 1 straight to the booster. Ideally, we would want to go from 1 to 2 to 3 if we could. But folks taking time off work, folks feeling the symptoms is not necessarily the best bet for individuals. So I've seen people go from only 1 dose straight to the bivalent booster. It's really going to be what you can manage, I guess, is the easiest way to go about it. Some folks get the 1, then they get the bivalent. Some folks don't get either, and they just go straight to the bivalent. I guess there's no real answer on that, but the main point is to get them up to date with their bivalent booster, even if they've only had 1 dose to begin with. I said a lot of things there. I don't know if that was helpful, Erin.
No, yeah, thank you. That makes sense. So basically they have options, but they do need to restart if it's been, over a year. And it's very true that is what deters people from getting that second shot, is the symptoms and having to be out of work and having to do that again. So being able to tell them that they have other options, they just need to talk to their doctor about it. That might be helpful for sure. Thank you.
And if that really is a hindrance, I would just recommend going straight for the bivalent booster, because that is most likely what the doctor is going to give them anyway, so they wouldn't have to go through with steps 1 and 2. Every provider is different, so every doctor is going to have their own comfort level. Like I said, I've seen folks go from having 1, waiting 2 years, getting that primary again straight to bivalent, but we've also had folks get that 1 2 years ago, have a 2-year lapse, go straight to the bivalent. So I would recommend for the folks that you work with, maybe, because it does, take a toll. You have to take time off work. Maybe you have to find out where you're going to watch your kids because you're going to be sleeping or you're not going to be feeling well. Just go straight for that bivalent booster. And especially as we start seeing the costs come for vaccines at the end of summer. So, but thank you for coming off the mic. It was nice to hear your voice. All right. Are there any plans to integrate the COVID-19 booster and the annual flu shot, so they are dispensed at the same time? That I have not heard. I have not heard any chatter about that, about doing it at the same time. I would imagine we're going to start seeing messaging probably come out at the same time about getting your flu shot and getting your updated booster. But I'm not sure what's in store come this fall. I will say, for my past experience, just a couple days ago, I got 3 vaccines. I got the bivalent booster, my Hep A vaccine, and monkeypox vaccine, all on Monday in the same arm. So it is definitely possible. And then Erin says they got their booster and flu shot at the same time, both times, and they got them. So it looks like it's a thing that we can do. And it's very true. It could decrease the instances of procrastination if they are done together. very true, especially as we start seeing cost as well. So it will be interesting to see what's to come in the fall. Having insurance, having medical, we're you'll be able to receive. It's the uninsured individuals where even getting a flu shot is hard to obtain, as that comes with a price. So having a flu shot and a COVID-19, both with a cost to them, is going to be a burden to a lot of households, and potentially having to choose between whether you get a flu shot or a COVID-19 booster, something I don't look forward to kind of mitigating as we end the Federal Reserve. Yeah, the global COVID-19 spread trend. I do not know, my friend. I've been very focused on us nationally and us here locally as well. So locally, I can say that we are doing good. Nationally, we are on a little bit of a decline as well. The Kraken variant was a spike, especially on the East Coast. And then globally, man, I've been out of the loop. But maybe by the end of this meeting, I'll have a good update for you. And then these are just other talking points kind of around boosters. So the updated COVID-19 booster, it's COVID-19 and changes into new variants over time. So the new Moderna and Pfizer booster, also called the bivalent vaccine, it protects us around Omicron, which is the BA.4 and the BA.5 and the original variants of COVID-19. So the ingredients in this updated bivalent booster use the same ingredients as the original COVID-19 vaccines, with a change to just one of the proteins. And this protein change is specifically aimed to target the Omicron variants. Did not change. All right, so who can get boosters? So anyone aged 6 months or older who finished their primary COVID-19 vaccine series and has at least been 2 months since their last vaccine or booster dose. So if you've recently had COVID, when should you get the updated booster? So ideally, you want to wait until you're fully recovered and you don't have any symptoms. It's always good practice to talk to a healthcare provider about the best timing to get the booster. We've heard of some people waiting up to 3 months after recovery. But if you haven't had a bivalent booster and you just got over COVID, especially wait until your symptoms have subsided, you're testing negative, and you're starting to feel a little bit better. So what will be the cost? This is a message in the chat box, but what will be the cost of the vaccine in the drugstores? We don't have a direct, an exact number on what the COVID-19 vaccine is going to cost. We predict that it is going to run, almost parallel to the cost of a flu vaccine. So that's around like $50, but it's still a little too early to tell. They haven't set prices. So for folks who are insured, you will most likely have very low or no copay for that COVID vaccine. But for folks who are uninsured, there will be a cost to it. We just don't know that price yet, my friend. So once we find out, we will definitely keep you all updated on that. And then I do see Dr. Seema, Moderna is working on a combination vaccine, which will protect against both COVID and flu. Not sure if it will be available this fall or not. And Dr. Seema, I don't know if you want to talk about that or feel free to come online.
Hi, Justin. No, I didn't need to add anything more. This
Perfect.
is something that I've read as far as what Moderna is working on. Because the technology that they used, actually, it's kind of interesting. Just wanted to add this, that, the work that Moderna had been doing initially was actually they were working on a flu vaccine. And then when COVID hit, they pivoted and started working on the COVID vaccine. So you already have the technology where they can make a vaccine which will incorporate both the flu protection as well as COVID. So, but it's just a matter of time that they'll have so that people can just get protected against both viruses in just one shot. So that'll be good to have at some point.
Yeah, no doubt. If you find any other information on that, Dr. Seema, please feel free to send it our way. But thanks for bringing that up. Appreciate that. All right, we are almost done talking about, the bivalent booster and different variants, but I'm going to read this slide for folks as well. So why do we have different COVID variants? So viruses are always changing. The more a virus spreads, the more it changes or mutates. When a big change happens, scientists call it a new variant. So some variants are less harmful, while others are dangerous. So we saw Omicron and Delta be pretty dangerous, mutations of the original COVID-19. And scientists are concerned about variants that are easier to catch and spread to others that cause more severe illness. So if we look at the Kraken variant, the XB.1.5 that we saw, towards the tail end of the winter, it was a lot easier to catch and a lot easier to spread, but it didn't come with a more severe illness. So all variants are different, but they're constantly changing. And that is what the bivalent boosters, which will be coming out in the fall, almost on a yearly schedule, will be aimed at taking those variants that we've seen throughout the year and putting them into a booster for us. All right. So I gotta remove some screens here as well. And one sec. So how many shots do kids get, and what are the common side effects for babies and young children? So children should complete the full series of doses for the vaccine to be affected. So Pfizer, we have 3 doses for children, and that's going to be from 6 months to 4 years. Moderna is 2 doses for children, 6 months to 5 years. And the side effects are going to usually last about a day or two, still that we see in folks older than 4 years as well. So some of the side effects, soreness where they get their shot, irritability, crying, sleepiness and fatigue, and loss of appetite. The less common side effects, nausea, vomiting, fever, chills, and swollen glands. So these are normal for folks aged 6 months to 4 years. It's their body is building a protection. But just wanted to highlight again, Pfizer is 3 doses for children and Moderna is 2. And the vaccines that, ages 6 months to 4 years are different than the ones that adults are getting. Or sorry, they're not different. They're different doses. They're the same vaccine at a different dose. So a Pfizer vaccine, anyone under 5, they're receiving 3 microgram doses. Children 5 to 11, they're receiving a 2 microgram dose, and children 12 and up get 2 30 microgram doses, which is the same as the adults. And it works very similar to the Moderna vaccine. So children under 6, they receive 2 microgram doses, 6 to 12 receiving 2 50 microgram doses, and children 12 and up to adults are receiving 2 100 microgram doses. Yeah, just want to put that out there. So staying protected against the new variants, as we talked about, Omicron, and then the new one, XBB.1.5, also known as the Kraken. The best way is just going to stay up to date on your current boosters and your COVID-19 vaccines. Outside of that, it's important to assess your own risk level. Keep that in mind. Will you be around others in indoor settings? Consider wearing a mask. If that establishment, especially in healthcare, long-term care facilities, correctional facilities, they have dropped their own mask mandate. If you feel safer doing so, wear your mask. Not just any mask, it's important to wear those N95, KN95 for the best protection. And then keeping up with the messaging that we've, been talking about for the past 2-3 years now is to avoid poorly ventilated spaces and, maintain that physical distancing from others. If you feel sick, stay home, get tested to determine the best course of action. So getting tested is going to be a little bit more trickier as we move past the May 11th. If you have those at-home COVID tests, it is good, to keep a hold of those so you don't have to go into your local pharmacy and use your medical for that as well. But just a couple things we're going to kind of have to adapt to as May 11th is near. That is all, folks, around COVID. I'm going to jump into a couple other things around events that are happening locally. But before I do so, is there any questions about boosters, declarations, mask ending, Federal Reserves, anything we want to talk about around COVID before I start kind of talking? I have a couple more slides here, and then that is it. All right, so there is an event. It's going to be on April 27th through April 30th, 2023 at the Seattle Center. This is for people in need, and all services are free. There's no identification required. There's interpretations available, and this is a free dental, medical, and vision service. There's limited number of admission tickets. The distribution for these tickets are going to start at 5:30 a.m. at the Fisher Pavilion at the Seattle Center, and it's going to be a first come, first serve. So there is parking available at these events. And I will just kind of break down some of the services that they're providing. But dental, we're going to see fillings, extractions, x-rays, deep cleaning. Vision, we're going to have vision screening, complete eye exams, reading, and prescription glasses. If you bring a current eyeglass prescription no older than 2 years, you can skip the eye exam and just go straight to getting your glasses. Medical, we have physical exams, x-rays, mammograms, ultrasounds, lab tests, immunizations, foot and wound care, dermatology, physical occupation, acupuncture, chiropractor, and behavioral health. There's also going to be social work and help with health insurance at this event as well. So just a reminder, it is April 27th through 30th at the Seattle Center. And admission is free, no identification is required, and it runs from 5:30 in the morning is when you can get in line to get some of those services for you or your community. And then Celia, my friend, you can go from here.
Yeah, thanks, Justin. I just wanted to let folks on the call know that I host a inner wellness 8-part mental health series. I mean, it's geared to Pacific Islanders, but I think everybody can benefit. I just dropped our advertisements in the chat. The link is there if you're free on a Tuesday night or have some folks who could benefit from mental health therapy and just how to navigate this system as BIPOC community members. We have 2 amazing Pacific Islander women who kind of lead us down that path. And this next conversation is kind of a 2-part conversation dealing with kids who run away, and then their parents and mitigating strategies to help them cope with their kids. Because we just found that during the pandemic, there was a lot of mental health crisis and kids searching and seeking for approval in other areas. So, yep, just wanted to throw that out there and just let folks know that you're invited. Thanks, Justin.
Yeah, thanks for that, Celia. And then we do have a question in the chat from Aaron. I believe this is in regards to the April 27th event. There are no eligibility requirements. So the clinic is for anyone who is in need or struggles with access or affordable care. So patients do not need any form of ID to receive services. So all are going to be welcome, regardless of income, insurance, housing, or immigration status. And I just want to stress that events like this, admission tickets start distributing at 5:30 a.m. and there is free parking. It's very central to a lot of different bus routes as well that will get you to and from the Seattle Center. It's in pretty much right in downtown Seattle. But yes, no eligibility requirements. It's just aimed at folks who struggle to access affordable care. Hope that answered your question, unless you're referring to Sealy's. But I didn't think so. All right. So kind of the last thing here we want to talk about is change how the U.S. Census and federal surveys produce racial and ethnic data. So for the first time in over, oh my gosh, like 100 and something years, the federal government is proposal for updating race and ethnicity statistical standards. So what you would normally see on a census form. So they're taking steps that could change how the US Census and federal surveys produce racial and ethnic data that is used for redrawing voting districts, enforcing civil rights protections, policymaking, and research, and also eliminating a lot of problematic statements that are on census forms in the past. When it comes to what is your race, are you Hispanic or Latino, and other words that, are just not used in today's society anymore. So this is like one of the first times that the federal government is asking for you to give feedback on how collecting, race and ethnicity data can be more acceptable for you and your community. So there is a link which we can drop in the chat, and it will also be in the follow-up bulletin that will lead to a comment section where you can comment on how you think the federal government can do a better job at asking about race and ethnicity. And I want to stress again that this is an historic moment, one of the first times that the government is willing to change how they collect data to be more inclusive to race and ethnicity and heritage and the ways that they go about collecting it. Gina, I'm not sure if you wanted to add anything on top of that. I know you've been working with this quite a bit, or if I summed it up well enough.
Oh no, you did a great job. Just encourage folks to comment on submit a comment. As you can see, there's still they still use terms that are very, very outdated and quite wrong, like American Indian. So it's a great opportunity to submit our feedback and do some data desegregation. Thank you, Justin.
Yeah, thanks, Gina. And lastly, we have moved our meetings to be monthly here. So our next meeting is going to be on May 3rd. 4 weeks after that, May is a longer month. We will meet on May 31st. And we have now pivoted our messaging towards a public health bulletin. So we will be, you should have received 2 now. The plan is middle of the month, we will be sending out another bulletin, which will highlight a lot of other great resources, give a really small, brief reminder of the meeting, but really highlight some of the resources in community, a lot of the stuff that we talked about here on this call. And then the day before the meeting on May 3rd, you're going to receive another email that is going to be specific to reminding folks about this call moving forward. So on a once a month, depending if that month is longer, it will be twice a month. But our next meeting for folks is going to be on May the 3rd, followed by May 31st as the last meeting in May. So thank you all for joining us. I know we said this meeting is till 5, but that is to leave way for questions and all that jazz. So I will be sticking around for a couple more minutes. If there's any questions, I will be here. If not, I want to thank you all for joining us. Thank you, Gina and Celie, and for everyone else who has participated in this call today. And thank you to our interpreters, all of them. Much love to you.